Welcome to the other video where we're looking at the ways of prevention. We are still looking at time for health. We are talking about cholera. That's our discussion. So let's look at the ways of prevention of cholera. We are looking at the idea that we need to have a safe water supply. So having a safe water supply ensure access to clean and safe drinking water can be one of the most fundamental important thing in preventing the spread of cholera. Treat water through methods like boiling, you're supposed to boil with the water, and chlorination or filtration to eliminate cholera bacteria. That's the way in which you can eliminate the cholera bacteria in the water by having access to clean water and safe water supply. Then we have sanitation improvement. Develop and maintain proper sanitation infrastructure. So if you have a proper sanitation infrastructure, it's supposed to be clean. That's the issue of a proper sanitation infrastructure, including sewage systems and waste disposal, which is very efficient. Discourage open defecations and promote the use of sanitary facilities. So this is whereby you look at the idea that you are supposed to have the use of sanitary facilities, whereby we look at sanitation. We need to have decision influence, facilities and use and maintenance, which means maintenance is key because we need to continue to maintain this sanitation infrastructure to make sure that it prevents the spread of the cholera bacteria, which is very important. So when you look at sanitation, it's all about, that's why we have included sewage systems and waste disposal. They're supposed to be efficient with sewage disposal and waste disposal, because if we don't have an efficient waste management system in terms of sewage disposal and waste disposal, we're going to be continue to have hotspots of cholera. So we have to know that we're supposed to have an efficient and the waste management system that is that can be used to prevent the spread of cholera. Then we have hygiene practices. We're supposed to practice hygiene, right? You're supposed to know that you are using an environment which is clean. That is the idea of hygiene practices. So encourage regular hand washing with soap. You're supposed to wash your hands with soap, especially after handling food and after using the restroom. You're supposed to wash your hands because that's where you contaminate the cholera. So washing your hands with soap stops cholera from spreading. Educate communities on the importance of personal hygiene to prevent the spread of the bacteria. So this is very important because we need to educate our communities. These are the most vulnerable in terms of access to having hygiene practices which are very poor, which means they need to be educated to know how do they practice hygiene. So that's very important. That's why from the picture we're looking at the issue of drinking of safe water, washing of hands with running water from the tap, and also we're looking at cooking food which is clean and also which is covered up and hot. Always eating hot food because it stops, and also wash your fruits and vegetables, and also supposed to consider getting vaccinated. That's why we talk about the idea that you're supposed to be early seek medical attention very early if you know that you have symptoms of cholera. And also you're supposed to clean up and safely, which means you're supposed to have to be at a safe and clean up environment, because having experience to a clean environment stops the spread of cholera, which is very important. Then we have food safety, because we all have to eat, but there is an issue that we're supposed to look at food and also looking at how safe is the food that you are consuming. So we're supposed to promote safe food handling practices, including thorough cooking of seafood and proper washing of fruits and vegetables, because don't know where they are coming from. So either they were washed when you bought them, doesn't matter. You're supposed to rewash them because you want to cook them. Thus avoid the risk of cholera. Also avoid consuming raw or uncooked food, particularly in areas with known cholera risk, because we also have hotspots in most countries. So you're supposed to avoid eating food from those hotspots which are vulnerable to cholera. So we should look at the steps for food safety. You're supposed to be able to be clean. You're supposed to be able to separate. You're supposed to cook. You're supposed to chill. So this is very important to know that these are the 4 steps of food safety that are very crucial in preventing the spread of cholera. So also consider vaccination, guys. This is very important. Implement vaccination campaigns in high risk areas to provide immune against cholera, because you already know that we have already identified a high risk area which is vulnerable to cholera. So it's we're supposed to vaccinate. So we're supposed to prioritize the vaccination for individuals, communities prone to outbreaks, because these are the people which they don't have that education. Their environments already providing poor sanitation. So we need to be able to prioritize vaccination so that they can have it and stay further in preventing the spread of cholera. Education and awareness, this is very important, guys. The idea of education, conduct public health campaigns, raise awareness about cholera, its causes, and the preventive measures. This way, by you go and do a community engagement, you go and educate them about the risk of cholera, and also um, giving them the awareness that if you don't prevent cholera on time, your children are going to be affected by cholera and they are going to die. So they need to be able to be taught about that. Provide education in proper waste disposal. What are you supposed to do with your waste after you you have you have done something? Also, you're looking at the idea that they should practice hygiene practices and the importance of clean water. Why should you be able to drink clean water? Why is clean water important? So we are looking at the idea that they're supposed to always wear a mask, clean and disinfect areas that they know that they're not clean, wash their hands with soap, cover your cough whenever you're coughing, and cook your food well, which is all in the bracket of education and awareness, whereby we're giving them the proper education about how best they can prevent the spread of cholera. Then also you have to look at prompt medical treatment. Ensure prompt medical attention for individuals showing symptoms of cholera. Which you look at what I'm saying, that the idea that if we are having individuals that are showing symptoms of cholera, we are supposed to minimize the severity of the disease and prevent further transmission, because we're supposed to treat it early, which is very important. That's why we're supposed to know um, the doctors are supposed to have the cholera treatment kit, which is very important. So that's how you look at the prompt medical treatment. Then, at our summary in ending this discussion about cholera, we are supposed to be looking at implementing these preventive measures collectively can significantly reduce the incidence and impact of cholera outbreaks. Which means if you implement the points or the preventive measures that we're discussing, you are likely going to reduce the spread of cholera. Also, public health intervention and community engagement, whereby you are going to the community that is much more prone to cholera infection. The idea that you are vaccinated them early, you're giving them proper education, you're giving them hygiene practices, will play a crucial role in the successful prevention of cholera. These strategies are very important. So, thank you so much for watching this video and watching the first video and the second video of the slide. This is the last video. Make sure that you subscribe to Time for Healthy. I'm going to be putting more videos going forward. We're going to be discussing things like GBV. We're going to be discussing about drug abuse. So thank you for getting in touch.